webinar. My name is Thaarenee from the National Cancer Society of Malaysia, and I'm delighted to be the moderator for today's session. As you may know, World No Tobacco Day is coming up on May 31st, 2023. To celebrate, we from the National Cancer Society Malaysia have organized a series of webinars titled Harm Reduction in Tobacco Control, running from April to May 2023. This series of webinars aim to raise awareness about the false narrative of harm reduction strategies in tobacco control and their impact on public health. Over these sessions, we'll be exploring various aspects of reduction in tobacco control, understanding the issues with vaping and health, communication strategies in dispelling those common myths, and misinformation for our tobacco control advocates. We have invited representatives who are strong advocates in the field of tobacco control to share their expertise and insights in support of this series of talks. Today's session is the fifth in the series, and we will be exploring the topic of myths in harm reduction in tobacco control, sources of misinformation, or as I like to call it, myth information. Due to unforeseen circumstances, Dr. Murli Monasamy, the Managing Director of National Cancer Society of Malaysia, who was supposed to be our first speaker, is unable to attend today's session. And we are honored to have Dr. Norliana Ismail, who is a Senior Principal Assistant Director of Tobacco Control Unit and FCTC Secretariat, Disease Control Division, NCD, for joining today's session. Thank you, Dr. Liana. As the first speaker for today's session, Ms. Alysa would be talking on behalf of Dr. Murli. She'll be discussing on finding and understanding legitimate sources of information on harm reduction. After that, Dr. Norliana will speak to us about the introduction to distributors of information. If you have any questions, please feel free to ask them through the Dockety platform. Our speakers will answer as many questions as possible within the allocated time. Ms. Alysa, I will hand over the session to you.
Thank you, Thaarenee. So I'm just going to share my screen. Okay, is everyone able to see my screen? Yep, okay, all good. Okay, so thank you, Thaarenee, for the introduction. So as she mentioned, today I will be speaking on behalf of Dr. Murli. If you are interested in seeing him speak, fret not, as he was one of our main speakers for our previous 4 sessions, as well as the upcoming sessions for the rest of this series. Previously, we spoke about the false narrative of harm reduction, the harms that harm reduction causes, vaping as a new harm, and perspectives in harm reduction, specifically speaking about harm initiation and harm reduction. If you have missed any of these sessions and are interested in learning more about this topic, please feel free to catch up on the recorded sessions that we have available on YouTube, as well as through the Dockety platform. So moving on to today's topic on myths in harm reduction in tobacco control and sources of misinformation, or as I like to think of it, myth information. I'm going to be talking through some of the myths regarding harm reduction, particularly in relation to e-cigarette products and vaping products, and be dispelling them one by one with facts backed by science and scientific evidence. After that, we will have a look at several sources of myths in harm reduction, as well as go through several reliable sources for more information on harm reduction. So myths in harm reduction and factual correction. So why do these myths even exist in the first place? Proponents of e-cigarette products, or as we like to call the pro-vape community, will be more likely to spread myths and misinformation related to tobacco harm reduction. Now, this is because these myths may mislead current and potential users of e-cigarettes into starting or perhaps continuing to consume them. And this undermines the current public health and tobacco control efforts that we currently have in place. And these myths may mislead potential users because they make e-cigarette products and vaping products seem like a safer, less harmful alternative, more beneficial to smoking cessation, depict them as more attractive to their users. And so it is very important. The reason why we are even including this topic in our series of harms and harm reduction is simply because these myths need to be dispelled by strong scientific evidence and reliable sources and research before more adolescents and adults decide to partake in this growing consumption of e-cigarette products, because this presence of misinformation will lead to decision making that is not very informed. And so it is very important that we discuss these myths and present the factual corrections to them. So the first myth we have today is some people say that the only toxic chemical in vape e-liquid is nicotine. So as we all know, nicotine is a highly addictive substance found in both cigarettes and e-cigarette products. However, it is not the only toxic chemical found in vape. Vape juice contains several toxic chemicals, over I think 31 chemicals that are currently identified and characterized. And some of these compounds, for example, formaldehyde, become toxic when they are heated and the aerosol is formed. Research also suggests that flavors, when combined with other vape juice ingredients and when they are heated, can create new compounds that may be harmful. And inhaling these harmful substances can then affect more than just the lungs. And this will also be discussed in the following slides. And the harms that have come from vape have also been discussed in our the third session of this series, when we discuss vaping as a new harm in harm reduction. So some of the compounds found in vape e-liquid can turn into toxic compounds when heated, forming aerosols that contain harmful chemicals. So moving on to the second myth. So pro-vape or proponents of e-cigarette products will say that vaping is a much safer alternative to smoking. Well, the fact is that vaping is not any safer than smoking. E-cigarette aerosol contains toxic and potentially carcinogenic chemicals that are detrimental to health, for example, propylene glycol, glycerol, diacetyl, formaldehyde, and methyl glyoxal, just to name a few. And exposure to these substances, be it through inhalation, may lead to significant respiratory, cardiovascular, oral, and liver health problems. So why it is very important to dispel this myth is because a lot of people see vaping as a safer alternative to smoking. So they either take up vaping in the hopes of smoking cessation, or they eventually become dual users. And dual users, I believe, is something that we have also discussed in the first series. So moving on to the third myth, that there are no health risks associated with secondhand or passive vaping. So as we all know, the research is very clearly established regarding the effects of secondhand smoke. We know that the health effects are just as detrimental whether you are a bystander secondhand smoke compared to being an actual smoker. But obviously, as vaping is still relatively new, there is still no extensive body of published research on the health risks associated with secondhand vaping. With that being said, recent studies have come out recently that have shown that secondhand vape exposure may actually be associated with adverse respiratory health symptoms and even mental health effects. So it is, with this myth, it's very difficult to absolutely say that there are no health risks because a lot of people that take up vaping, they will bring this up and say, oh, I'm only causing danger to myself, I'm not harming others. Because previously with smoking, we know that one of the big reasons as to why smoking is such a big public health problem is that it can also cause harm to the health of those around us. So obviously it was not just a matter of saving the individuals who smoke, but we're also trying to save the lives of those around them as well. So proponents of e-cigarettes will bring up this myth and tell you that, hey, no, if I vape, it's not going to affect anyone around me, so it's okay. I'm willing to deal with the consequences, the health consequences of my actions, but it's okay. My family is not going to be involved or anything like that. So that's why I think a lot more research has to go into this. But I think it's definitely safe to say that with any vices in this world, there's definitely not going to be an absolute of no health risk associated with them. And moving on to the next myth is that vaping can be used as a smoking cessation tool. So following on from my point, the second point saying that some people say that vaping is a safer alternative, So as of right now, there is inconclusive evidence to suggest that vaping can actually be used as an aid to smoking cessation. In fact, vaping may actually lead to smoking initiation for those who did not smoke cigarettes at all prior to vaping. So perhaps the benefit that probe vapes, people think that we will benefit in a sense that there will be less people smoking. But this may actually, lead to a counter effect in terms of benefit in the long run, because there will be more people taking up vaping, and if anything, there will be more dual users. So the effects of tobacco smoking or just smoking in general will probably still remain the same. If not, the burden will go up. So there was a systematic review that showed that e-cigarette consumption was linked to a higher risk of smoking initiation. So again, it's very important for us to try to dispel this myth that it's actually used as a viable smoking cessation tool, because then you will have many people who were current smokers or past smokers who take e-cigarettes up in the hopes that they will stop smoking. But then in the end, they just expose themselves to another harm, leading to detrimental health effects in the future. So in terms of smoking cessation tools, we should be proponents of better cessation tool aids, for example, nicotine replacement therapy, as opposed to advocating for e-cigarettes as a smoking cessation aid. And the next one is that e-cigarettes are not intended for youth consumption, and youth vaping is not an epidemic. So e-cigarette products come in many shapes, sizes, designs, flavors, and all these colorful and various types of e-cigarette packaging. In addition to the vigorous advertising done by tobacco companies, most likely targeting adolescents, attract adolescents to take up vaping. There was one study that found that over 78% of middle and high school students were exposed to at least one advertisement promoting e-cigarette products. Another study found that the various flavors of e-cigarette products, so for example, you have different flavors like candy flavored, fruit flavored, menthol flavored, and they appealed to adolescents more than tobacco flavored products did. So as you can see here, during my research for this talk, I discovered that there is such thing as these tiger pods that look like Game Boys or Tamagotchis that kids like to play with, and here you have them as vapes, and they advertise this as some sort of like fruit refreshing thing to be consumed by kids. So when proponents of like tobacco companies and proponents of vape and e-cigarettes, they are very strict in saying we are very against youth consumption of these e-cigarette products. They're only made for these different flavors are only made for our adults, and we do not want young children to be taking it up. Clearly, you can see that if that was not the case, why do we have such a big range of e-cigarette products with different shapes and colors and designs? That's not to say that we adults can't enjoy some colorful designs, but clearly we do know that generally these kind of advertising and these kind of products are generally catered to attract children. And so again, pulling on from the point of vaping being a smoking cessation tool, in the end, we have non-smokers, people who have never smoked, particularly the adolescent community, initiating, taking up vaping, and most probably eventually taking up smoking as well. So next we have the myth that vaping is less addictive than cigarettes. So most e-cigarettes actually contain nicotine, which is everybody knows that it is the chemical substance that makes vaping as addictive as smoking cigarettes. Vaping may lead to lifelong nicotine addiction amongst users, and particularly for young non-smokers who take up vaping. So obviously, pro-vape proponents of vape and e-cigarettes can say that, oh, vaping is less addictive than cigarettes because there are some vapes that do not have nicotine, but we will discuss the myth about nicotine-free vape in a bit. So the next myth is that it's just water vapor. So the fact against that is that vaping is not just harmless water vapor. This e-liquid typically contains nicotine, flavorings, and other harmful chemicals, as we discussed previously in the previous sessions as well. And when this is heated up into an aerosol that is inhaled, more toxic chemicals are formed. So the reason why it is important to dispel this myth is obviously, in science, in school, we used to learn, water vapor is just, when water evaporates into gas, it's something very harmless, nothing dangerous. So obviously, when this fact is being spread, anybody who wants to take up vape or is currently taking up vape is just going to be like, oh yeah, it's just water vapor. It's not going to harm it's not going to be harmful to my health. So again, it's very important that we are very careful with the words that we use, especially in terms of harm reduction, because the use of the word water vapor itself makes vape seem much more harmless than it actually is, because vapor is generally seen as something harmless. And the next myth that I mentioned a bit earlier is that nicotine-free vape is harmless. So the pro-vape community will say that, okay, if you say that nicotine is a harmful chemical and it's making people addicted to vaping, making people continue to smoke cigarettes, they will come up with this statement saying nicotine-free vape is harmless. So in the hopes that, more people will take on e-cigarette products that are nicotine-free. But an absence of nicotine in nicotine-free e-cigarettes does not make it harmless. Although the component of nicotine addiction is removed, vape users can, still get addicted to the different flavors of vape available. As I mentioned earlier, there were so many different flavorings of the e-cigarette product available. There are still so many other things that people can get addicted to. Just like in this world, there's so many things that people are addicted to. It can be food, drinks, and they don't even contain nicotine. And then for those who transition from the use of e-liquids with nicotine to nicotine-free e-liquid, they will eventually have nicotine withdrawals and crave that nicotine hit, leading to an eventual reversion back to e-cigarettes, which contain nicotine, or even worse, leading to an eventual reversion back to the consumption of cigarette products which contain nicotine as well. So aside from it being addictive, as I mentioned earlier, the other chemicals found in nicotine-free vape can also lead to negative side effects, such as irritation to the airways. So in addition to the first myth that I was talking about, nicotine-free vape is not harmless because there are so many other chemicals and products found in this vape e-liquid. And lastly, there is this myth that there is a growing body of scientific evidence that vaping is safe and effective as a harm reduction and smoking cessation tool. So some of the research surrounding vape as a harm reduction and a smoking cessation tool is sometimes funded by cigarette and tobacco companies. And naturally, these types of research articles are less likely to find harms linked to their e-cigarette products. So this research will be biased towards providing evidence that backs up their products to show that they are safer than smoking cigarettes, as opposed to providing research on the actual harms that can be caused by their products. So the reason why this is an important myth to dispel is because it is very important that we are aware, especially when we are looking at research articles, to be aware that there's no conflict of interest with other tobacco or cigarette companies, and ensure that there's no conflict of interest, so that because the result might be more biased toward a result that favors a outcome that shows that their products are a lot safer, they don't have any harms to health. Okay, so moving on to sources of myths in harm reduction. So as I mentioned earlier at the start of this session, myths about tobacco harm reduction arise from different parties, for example, industry associations and advocacy groups that are proponents of e-cigarettes as harm reduction strategies in tobacco control. So again, these myths promote the less harmful and more beneficial effects of e-cigarette products. And by dispelling these potential fears, by dispelling the fears that these potential or current users have about the e-cigarettes, then they will be more inclined or more likely to begin or continue consuming these e-cigarette products. And so these associations and groups advocate for the use of e-cigarettes vaping products and promote them as viable harm reduction strategies. So all the myths that we mentioned earlier, these are the sort of proponents of e-cigarettes that use these myths, and they spread this information, be it on their websites, blog posts, articles, or resources, to spread these myths about harm reduction in hopes that more people will take up vaping and e-cigarette products. So these are just a few associations, to name a few. And so I will just be taking you through some of screenshots from some of their websites or FAQ sections that they have readily available for the general public, and generally for members of their association. And yeah, just this talking through some of the myths that they have listed in their resources. So over here we have the Smoke-Free Alternative Trades Association, SFATA, and it says they recognize that the science behind this new industry is growing nearly every day. They anticipate legitimate science conducted according to the scientific method, but with doing so, they do not even cite any legitimate sources while doing so. And then they also mention that we are against minors' use of these products, but we also believe that the deaths of over 400,000 adult Americans every year can be avoided by encouraging smokers to switch to this technology. So over here, you can see that, okay, they acknowledge that they are against youth consumption of e-cigarette products, yet in comparison to the large number of adult lives saved yearly due to switching to these products, it seems that the lives of these young people are not deemed as important to them, just judging from the statement that they've listed out here. So they are one of the proponents of e-cigarette products, I would say, that do not see youth consumption as an upcoming epidemic. And so they believe that, there's not much concern over teen experimentation. Next, we have the Independent British Vape Trade Association, IBVTA. So this was part of their FAQ section. So, they have questions such as, is nicotine, when consumed by vaping, dangerous? And over here, you can see that they say no. So they deny that there's any danger in the nicotinic content found in e-cigarette products. And they also say that it is not detrimental to the long-term use of nicotine is not detrimental to the health of the user. And then next, they also answer the question, will switching to vaping help me quit smoking? And then they say yes. And then they even nicely give you some vape shops that you can go to help you quit. And they also cite some other sources. And so this IBBTA association recognizes vaping as a helpful smoking cessation aid. And so again, this is just following on from one of the myths that we discussed earlier. And then there's also another question. I keep reading stories in the media about e-cigarettes. Is vaping really less harmful than smoking? So, and then they say, yes, they say there is never a situation where it is better to smoke than it is to vape. And then they cite, so there is this statistic that you see pro-vape proponents of e-cigarette products that they always cite vaping being recognized as being at least 95% less harmful than smoking. But when you actually look at this figure and where it actually came from, this figure actually came about as a rough estimate, actually based on the opinions of a small number of individuals and a lack of concrete evidence. And this review by the Public Health England has also been cited to have some conflicts of interest with tobacco companies. So again, this is just following on with the point of some tobacco companies having conflict of interest in the research. This is a statistic that is usually cited by pro-vape people. And again, just with the question itself, I keep reading stories in the media about e-cigarettes. So they are relying on these associations for sound information, but they're looking through the media. They're not really looking at reliable information by trusted sources. And next, we have the Canadian Vaping Association. So this was also on their main page of their website. And so they sort of come up with different blog posts for different topics. So these are some of the blog posts. So they say that flavored vapor products are not the reason for youth uptake. So again, one of the myths that we discussed earlier. And they also state that youth vaping is not an epidemic. So the slogan for this association is actually supporting the future of vaping, which is slightly ironic considering that they are doing anything but supporting our future, which is our future leaders, our current generation, our current youth, that we're trying to not get to even begin consuming e-cigarettes or vaping or tobacco products. And you know, they proudly say that youth vaping is not an epidemic and that flavored vape products are not the reason behind youth consumption of e-cigarettes. Next, we have a Malaysian association, a Malaysian E-Vaporizers and Tobacco Alternative Association. So this was actually on their Instagram page where they posted about estimated deaths and their causes in the past 70 years. So as you can see here, nicotine vaping, there's 0 deaths. And then there's the caption that says, when people are misled with false information, it creates a huge health scare that's real fake news. And so as vaping is still relatively new, of course, it is quite difficult to see what the long-term effects are, as well as, you know, the effects on morbidity and mortality. But it is a very unfair comparison to make when the dangers of behavior such as alcohol and cigarettes, the two listed at the top, you know, are already very clearly established over many, many years of research. So posts like these, you know, they minimize the danger that comes with nicotine vaping and really makes it look very, very harmless compared to, you know, these other vices. So when people read this, you know, they'll think, oh yeah, okay, 0 people died from nicotine vaping in the past 70 years. I should be fine because, you know, 0 is such an improbable probability, right? So yeah, so that's why it's, again, very important to dispel the kind of myth. And next, we also have the Consumer Advocates for Smoke-Free Alternatives Association, CASAA, and basically they, similarly in the FAQ section, they discuss things like, is there any evidence that vaping helps adults quit smoking? And then they say yes, and then they even go to say, if the products didn't work, they wouldn't sell. So making this statement, it's a bit, I think, of a stretch to say that, because just because their products are selling, just because their vaping products are selling, that does not necessarily mean that they are working as helping people quit smoking, because it's very difficult to actually find that out. And additionally, just because their products are selling, yeah, that doesn't mean that people are stopping smoking. If in fact, some people may end up becoming dual users. And then you also have our flavored nicotine vaping products really designed for adults. They say yes, they are only intended for adults. With the different flavors, and so they deny that, you know, they are actually for youth consumption and just push for the fact that it's only for adults. Similarly, they say that don't the flavors attract the youth? They say there's no evidence that any youth tried vaping only because of the flavors. And lastly, there's a question about, is vaping a gateway to smoking? And they say no. With the fact that vaping rates have increased over the past decade, but smoking rates have reached records lows across all age groups. So they even boldly say, you know, there is 0 evidence that vaping leads to smoking. I'm pretty sure you'll be able to find at least one article on this. So and yeah, moving on, we have the World Vapers Alliance. So this was a blog post that they came up with. They attempt to dispel myths about e-cigarettes and their harms by stating that, you know, adults prefer flavored e-cigarettes and that e-cigarettes are much safer than combustible cigarettes. So, and then we also have the Vaping Advocacy and Education Project. And here they say that anyone who suggests that vaping is not safer than smoking does not know what they are talking about, whether it is your physician, a nurse, or a representative from a health-related nonprofit. Question everything that they say. So, you know, they are getting you to, they're encouraging people and members of the association to scrutinize and question the advice and information provided by healthcare professionals. And, you know, they claim that non-profit organizations who are anti-vape discourage the consumption of vape simply because they do not want to reduce the number of smokers so that there will be a higher incidence of smoking-related diseases, and then they can, you know, stay in business and continue to advocate against smoking-related issues. Yeah, so over here you can see that, you know, they're getting you to question respected health professionals, and they are targeting non-profits who are simply just trying to help advocate for, you know, better tobacco control. And so yeah, it's very important that we try to dispel these myths and this misinformation. So moving on to sources of accurate reporting and information in tobacco control. So everyone knows everybody in this session is obviously aware that tobacco control is a public health priority, and accurate reporting and information are essential in being able to create effective policies, interventions, and also allow for informed decision making. So we have some reliable sources over here. So obviously the World Health Organization. Here are some reports that have been established and written up on tobacco and nicotine and other tobacco product regulations. Then we also have the Centers for Disease Control and Prevention, the CDC, similarly coming up with a e-cigarette or vaping product visual dictionary. And then we also have academic journals. Obviously, another reliable source of reliable information is peer-reviewed journals that publish original research and systematic reviews, which provide valuable insights into tobacco use and control. So some of the prominent journals in tobacco control include Tobacco Control, Nicotine and Tobacco Research, and the American Journal of Public Health. So these journals publish articles on topics such as the effectiveness of tobacco control policies, the impact of tobacco advertising and marketing, and the use of e-cigarettes as a harm reduction tool. And another source of accurate reporting and information in tobacco control would be non-governmental organizations. So NGOs, for example, the Campaign for Tobacco-Free Kids, the International Union Against Tuberculosis and Lung Disease, and the World Lung Foundation. They conduct research and advocacy on tobacco control. And these organizations also provide technical assistance and support to governments, civil society groups, and other stakeholders working on tobacco control initiatives. And then lastly, you have academic institutions and research centers, which are also critical sources of accurate reporting and tobacco control information. So these institutions conduct research on tobacco use and control. They train researchers and practitioners and provide technical assistance to governments and NGOs. So these are just a few examples of the academic and institutions and research centers that focus on tobacco control. So lastly, just to end my basically this part of the session. So accurate reporting and information, as we can see from all the different myths that we have seen today, from all the different associations, all the different websites, it is crucial in tobacco control. Accurate reporting is very, very important. And there are various sources available to policymakers, researchers, practitioners, and also just the general public, because it's so easy to access information. So it's important that the information that is out there is reliable and accurate. And these sources include international organizations such as WHO, the CDC, academic journals, NGOs, and academic institutions, as we mentioned earlier. And so by relying on accurate and reliable sources of information, stakeholders can then develop evidence-based policies and interventions that will have a positive impact on public health. So yeah, that's it from me. Thank you so much for your time today.
Okay, thank you, Ms. Alysa, for extensive presentation on the topic of misinformation. Now let us welcome Dr. Norliana to present her take on the topic about introduction to distributors of information. Over to you, Dr. Liana.
Okay, thank you so much, Ms. Thaarenee. Assalamualaikum warahmatullahi wabarakatuh, and a very good afternoon to all. So this is my second time I'm in this webinar. So I was given a task to give a talk today with regards to, my slide didn't. All right. So my topic for today is introduction to distributor of information, as what has been presented by the first speaker. There's a lot of myths in harm reduction. There's also misinformation. So we have to understand the two perspectives here. So before I proceed further, I would like to revise back my previous slide during the second series on the differences in harm reduction strategies from public health view and also the tobacco industry view. So in principle, from the public health, there are a few what we call intervention that use harm reduction principle. The principle is to provide evidence base to lower the harm alternative for those who cannot quit the harmful substances. In this case, for smoker, of course, the nicotine and also the cigarette that has a harmful substances, which is a proven public health strategy. But from the industry view, they have been trying to co-opt the term as part of their business strategy and also to expand, to recruit more users and to also to grow the market for the nicotine product. All right. So the harm reduction strategy, what is it? What is the harm reduction strategy from the public health view? Is actually one of the intervention, which is with a very careful deployment of alternatives that are tightly focused on helping smokers who otherwise cannot or would not quit. While for the in terms of tobacco or vaping industry, and they want to grow the market by introducing more and more new product, and they are trying to use the appropriate public health language to attract consumer and also confuse the medical profession and also the regulator with their strategy. All right, who's behind it? Of course, for the harm reduction strategy from the public health side, it's a medical expert, public health expert with public health motive and also no conflict of interest. While from the tobacco company, of course, they are the one who are behind it with a profit motive. Okay, in terms of how the product is proven, is it proven? Is the product that used as a harm reduction? Let's say for cigarette, they say e-cigarette is a product that can be used to reduce the harm of cigarette. So how the product is proven? So they must be, from the public health view, there must be independent scientific research and also a vigorous regulatory oversight that consider the overall impact to the population. And when we want to introduce some so-called less harmful product, what is the overall impact to the population health? But from the tobacco or vaping industry, the product usually enter the mass market before even the evaluation of the impact of their product to the public. And most of the time, they will conduct a research that shows the good of their what is good in their product, and they often funded by them. All right. So in terms of where are the products are available, but in view of public health, there will be a specific establishment like methadone. We only do it in klinik kesihatan or certain clinics. It was not available to all, where the product are distributed by a qualified personnel, medical personnel with control to the people who can access it, and also people who are really addicted to the other substance. But in terms of industry side, their products are sold everywhere. They are sold everywhere in convenience store, gas station, near school, where all consumer go, and they even sold it to consumer regardless of the smoking status, not only to smokers. Right, and how the product is marketed, and of course, from the public health perspective, the product must be designed and only promoted with control, and we must to make sure that the product are not attractive to those who are non-user, and not for those who are never smoked but started to vape. So that is the view of public health. But from the industry side, the product are designed to in a ways to appeal to a broad audience, especially youth and kids. The flavoring, the design, the colorful packaging, the widespread market campaign is all the tactics they are doing to recruit more and more users for this new product. Okay, so in terms of research, and we can see the tobacco industry is trying to infiltrate the public health because the sales of cigarette actually declining, even though they are still a lot of smoker. In Malaysia, our prevalence is still high, 21.3. But overall, around the world, the cigarette sales is declining, and the tobacco industry is trying to rehabilitate their image with a new product, with a so-called product alah baru, or they say non-combustible. Cigarette are combustible, but this is non-combustible, and they claim it also can be part of the public health solution to end or to reduce smoking in certain countries. Okay, so they are trying to, they have managed to publish and also conduct a research from their side and overtly co-opt the language and look for a public health organization to make claim about the health impact of their new products, such as e-cigarette, heated tobacco product, or other nicotine product that they say are less harmful or can help smoker to quit, but usually not being supported by peer-reviewed research. And although they have this less harmful product, I mean, they are still continue marketing and selling their harmful or combustible cigarette around the world. So even though they are promoting this one, this is very less harmful, this can help medical profession, this can help smoker to quit, but the harmful product or the combustible product is still being sold in the market. So that is what we say they have conflict of interest, and what we can say they don't really genuine in what they want to achieve with the less harmful product. Okay, and then research. Philip Morris, for example, funded a smoke-free world campaign since 2017, and they have, I think, also conduct a research to infiltrate the scientific spaces and shape the public discourse. And Juul, the popular e-cigarette in US, also has sponsored an entire special issue of American Journal of Health Behavior to showcase all their research in one journal. So this is in terms of research funded by the industry. And of course, by allowing the industry research in scientific publication, it has a major consequences. It gives the industry a force equivalent with independent, credible public health research, and allow them to showcase their work to the regulators. And their participation, participation in academic conference and other scientific arena also can be seen to provide a critical insight into tobacco control evidence with strategy, with the tobacco industry can then use to counterback whatever policy or whatever scientific policy that has been initiated in certain countries. All right, and for example, I give you one example during the COVID time, how the spread of misinformation with regard to what they call vaping or smokers are protected from infected by COVID or from the complication of COVID, and where the social media platforms such as Facebook, IG, Twitter play an important role in spreading the idea that nicotine protects against COVID-19, because there are earlier one study that found that they said that smokers were less likely to be admitted for intensive care due to COVID, and there is very widespread speculation that nicotine has a property, anti-inflammatory property, and can be protected to the smoker or to the vapers from having COVID-19 or having severe COVID-19. But although there are a lot of more studies after that show there was no subsequent evidence, and even there are very conclusive evidence that says smoking weakened the immune system and will eventually raise the risk of infectious disease and respiratory infection. But the earliest claim that nicotine can protect smoker from COVID-19 has already spread like a wildfire on social media. So this is one of the example how the spread of misinformation is conducted. And in Malaysia, we also affected. There are paper that say, oh, smoker is being protected from having COVID because they smoke. And in view of that, we conducted our own study using our own COVID-19 data. And our study shows that smoker actually has twice risk of having severe complication of COVID-19 in terms of severe acute respiratory syndrome, liver, and also renal failure. All right, so let's go back to the evidence from our health organization, WHO, and others. Okay, what we know so far regarding the health effect of electronic cigarette or other alternative smoking products. Okay, if you can see the arrow here, in 2003-2004, the e-cigarette was invented and sold in China, and then about 2 or 3 years later, it was sold in Europe and US. And the first, I think, more or less earlier, among the earliest systematic review on health effect of electronic cigarette is already published in 2015, around 9 years of usage in US. And there is already a systematic review published about the health effect of electronic cigarette, which I will present it after this a bit on what has been found out from this systematic review. And in 2019, there is reported EVALI cases, e-cigarette and vaping associated lung injury that is associated with vaping's activity. It was reported in USA about around 3,000 cases with 68 deaths. And in Malaysia, we also have reported EVALI cases in 2019. And in view of that, in 2021, the Ministry of Health have published the clinical practice guideline on management of EVALI, and Medical Center also conduct a study on EVALI and with the grant from WHO. And in 2022, Ministry of Health has circulated a guideline for EVALI notification. So all doctors, if you are diagnosed EVALI is a probable or confirmed case, it must be notified to Ministry of Health, because we want to have a surveillance data of this effect from the electronic cigarette. All right, this is the systematic review in 2015 to WHO, and then this systematic review, they have comprised of 175 studies, and they also included studies who had conflict of interest, or meaning to say those industry funded studies. And most of the study during this time is study related to the content of fluid or e-juice. So around 105, there are 32 study on effect to the human, animal study, and also other adverse event related to the usage of e-cigarette. So there are 5 conclusions that I can highlight here. So the study that looked into the content of fluid and vapor noted that there is none of the product in the market are safe or totally free from toxic compound. They have, whether if they tested the content, there will be a toxic compound found in the e-liquid. The second finding, the in vitro study shows that this e-cigarette has a cytotoxic effect, oxidative stress, and inflammatory reaction to our body, to our cell in the body. And the third one, from the human experimental study, in 2015, around 9 years usage of in Europe and UK, and in Malaysia, we just started to have electronic cigarette coming to Malaysia in 2015, and most of the study that reported the human exposure is report those short-term exposure, and because the long-term we have yet to wait what are the effect of using electronic cigarette, cancer, chronic diseases such as cardiovascular. It develop years for the disease to manifest. In terms of passive exposure, yes, there are effect to others around who are not vaping, but they are exposed to the vapor. They can have some effect. And also when they do a test for indoor air quality, there are some toxic chemical found in the air, in the surrounding air. And in terms of the dual user, those who claim by switching to from cigarette to electronic cigarette, you can stop smoking. But this systematic review found 80%, 80, do not quit smoking, but they come up, instead of they become a dual user. They still smoke conventional cigarette, but they also use the vaping, so they become a dual user. So in terms of reduction of harm, we can't hardly expect it, and they might increase risk of themselves having other complications. Okay, other study or report that you can also refer, if of course from the WHO itself, WHO study group on tobacco product regulation, they are quite comprehensive in terms of health effect, in terms of whether it says the recommendation for quit smoking and so on. From the WHO study group on product regulation, they noted that the characteristic of electronic cigarette is very heterogeneous. It's very varied. The design is very from very simple to sophisticated, and some have very low nicotine or other toxicant, and some can have as much high as level as nicotine and other toxicant. And in terms of quitting smoking, they also find out that most of them didn't quit smoking, but they end up become a dual user. The US Surgeon General also reported that there is inadequate evidence to conclude that e-cigarette in general increase the smoking cessation. So this is the counterback, the information, the misinformation that has been spread from the industry side. So in Malaysia, we have CPG. Please refer to our clinical practice guideline, because we already mandated that all EVALI cases must be notified for the surveillance purpose. And for the cases, if you want to see a case that has been reported in UMMC, they have this report. They have actually handed to WHO, but they are in the process of having publication for this study they have conducted in 2021, and hopefully when the publication has already when there is a publication, we can share to all of the participants. Okay, and in Malaysia also there are a group that promoting the harm reduction, the tobacco harm reduction, to help smokers to quit, and they more or less did not agree or scrutinize the tobacco control bill, especially on the GEG provision. They don't agree that generational end game should be put in the tobacco bill. And again, I would like to revisit my previous slide. So if the harm reduction principle in smoking, if we really want to adapt the harm reduction in smoking, the target group should be for smokers. For smokers only, for those who are already addicted to the harmful cigarette and cannot quit. For the tobacco bill, the provision of generational end game, the target for the harm reduction should be in this category. Those who are not the GEG group, our generation who are born before 2007, who are already, some of us, addicted to the cigarette, and this should be the target, not the young generation who included in under the GEG group, who born 2007 onwards, which are still underage. Under the current control of tobacco control, they cannot smoke, they cannot use any smoking product. So there should be no smoker around in this GEG group. All right, but I think I repeat again, as you know, in reality, what we can see now, the electronic cigarette, vape, or other less harmful product is being promoted and being sold to every group, to everyone. They can access this product. This is how the industry market the vaping as a stress relief. They are very aggressive in the marketing because most of the country still did not have a proper regulation to control advertisement, promotion, and sponsorship for this new product. And also they are targeting not only the youth and the kids, but also women. I think the script is the same. If you can see previous years, they have how the cigarette targeting women, and now the e-cigarette also they are target women. Even they're promoting it during the Mother's Day. They have the cancer, breast cancer campaign, and so on. All right. So as a conclusion, I come to my last slide. So I would like to quote a few statements from WHO itself. So in terms of when we want to strengthen the implementation of tobacco and smoking product control, we already have a framework convention on tobacco control. We can increase the tax. We complete ban on advertisement, promotion, and sponsorship. We offer enough quit smoking services. So that with that strategy, we can help to reduce the prevalence of smoker in Malaysia, and also to help smoker to quit. And then this policy just not helping the existing smoker to quit, but also to prevent the initiation of smoking with the new generation. And then the WHO FCTC also said there is extensive evidence of tobacco industry funded research that was later used to prevent the effective tobacco control policy in countries. So it is clear that the industry aims to follow the same path in the area of non-traditional tobacco products, which are unregulated in many countries. Many countries still not have a regulation to control this new product. And the vital strategy state, we have seen the script before when the tobacco industry announced initiative, proclaimed it want to reduce the health effect of their daily business. It's really only promoted their product. It fund research to counter and also degenerate the independent health expert and research. So I think with that, I would like to thank to all of you that hearing my topic today, and I pass back to the moderator.
Thank you, Dr. Liana, for your sharing. We've had some captivating presentations thus far, and I think everyone will agree with me on that. We will now move on to the Q&A sessions from the Dockery platform. Okay. As we are running out of time, we will wrap up with takeaway messages from Dr. Liana with regards to today's topic.
All right. So I would like to thank you all for having such a commitment to follow on this series. This is the 5th series. We have, I think, another 3 or 4 series to go. So like I said, today's topic is with regards to the misinformation. So we have 2 school of thought there outside, those who are pro harm reduction and those who are against from the medical field who really said that for us to endorse any harm reduction strategy, we must see as the overall impact to our population. We cannot only see the benefit to those smokers, but we also must see what are the impact to those who are not not non-user. I mean non-user, especially the young ones. That's why, as for now, from the Ministry of Health perspective, we are still not convinced, and we are still did not recognize this product, the e-cigarette, the heated tobacco product, as a ways to help smoker to quit, based on the evidence that I presented so far, and also because the overspill effect to others that we are afraid, especially to the young ones.
Thank you, Dr. Liana. That brings us to the end of today's webinar. Once again, thank you to our speakers for sharing their expertise with us on today's topic, and to the audience for tuning in today. We hope that this webinar has offered you with valuable insight and has provided you with a better understanding of this crucial topic. Don't forget to tune in for our next webinar on communication strategies in dispelling harm reduction myths from the perspectives of tobacco control, which will be on Monday, May 15th from 2 to 3 p.m. And for those who are interested in our previous webinars of the series, you can visit our YouTube channel, that is National Cancer Society of Malaysia, and the webinars are in a playlist called Harms of Harm Reduction in Tobacco Control. Thank you for joining us today, and we hope to see you again soon. Thank you.